is Stacy Madrid. Today's date is May 26, 2019, and today's lab is the cardiovascular system part 2. I will be going over the blood vessels in the fetal pig. It is the dissection of the fetal pig, and I will go ahead and discuss that. I just want to go ahead and I guess apologize in advance. I'm not wearing the goggles because they fog up my sight, and I want to be able to accurately locate the areas. And then I hope you can hear me through this mask. Also, the blue dye, it's very prominent and it spreads everywhere, so it was kind of difficult to locate the differences, but I will try my best to go ahead and locate the arteries along with the veins, okay? So I'll went ahead and made an incision right here. Go ahead and pull the skin back and pull the muscles. Right here, you can go ahead and see the external jugular vein. And then these two blue ones right here are the internal jugular veins. Both of them lead this way into the, they lead right here, but I accidentally cut my brachiocephalic trunk, but it's right here, and they pretty much extend out. And then if I pull the heart back right here, you can see the superior vena cava. And then let's go ahead and onto the right side, you can see the subclavian vein, which obviously takes the oxygenated blood from the axillary into the right superior vena cava. And then on this side, you can see the left subclavian vein, and that's the same aspect. All these veins pretty much bring deoxygenated blood into the superior vena cava that goes into the right atrium. And then on this side, you can see the cephalic vein. Kind of hard to pull out. I didn't want to rip it, but it's right here, and that one runs through our arm. So again, all these veins up on this top portion pretty much carry deoxygenated blood from their locations into the superior vena cava. It goes into the right atrium, which is up here on this top portion. It goes through the tricuspid valve into the right ventricle, right here, and pushes that through the pulmonary artery. You can locate right there. Pulmonary artery into the lungs. This is one of those. These are the left side of the lungs, and then the right side. Sorry, just kind of have to pull it back. The right side of the lungs. And in the lungs, they go through the gas exchange from carbon dioxide to O2. So in the pulmonary veins, they carry oxygenated blood into the left atrium, which is underneath this portion. And then from the left atrium, it goes through the bicuspid valve into left ventricle, which is right here. And when it pumps that way, it goes through the back into the aorta. That was kind of hard to go just because of all this blue dye right here, but it's pretty much right behind here. And the aorta pretty much pumps blood to the top, to the head, to the upper extremities, and the lower extremities. So that's the portion, that's the cycle of how blood goes through the body. And then I just want to explain some other areas. I went ahead and did the pulmonary vein, the pulmonary artery that's right here, the aorta. This one right here and this side are the carotid arteries, and they carry oxygenated blood to the head on this aspect. I accidentally cut it, so apologies. And then the heart itself has coronary arteries that carry oxygenated blood to feed the heart to keep working. So those are pretty much all the areas I was able to locate. I want to thank you. And that